So as the National Health Service struggles with industrial action, staff shortages, post-pandemic recovery, more and more patients are turning to private healthcare to meet their medical needs, if they can afford it. NHS hospitals are also relying more and more on independent operators to cover their shortfalls in patient services. So David Hare, Chief Executive of the Independent Healthcare Providers Network, joins me now. David, thanks very much indeed for joining us. First of all, we're hearing so much about the NHS and the trials and tribulations it's going through at the moment. What's going on in the private sector? How are things being impacted by the seasonal problems with you?
Good afternoon, Andrew. So it's a really interesting question. Before the pandemic, and for many decades indeed, patients have had the right to choose to pay for their own treatment, either through private medical insurance or to self-fund their own treatment, paying directly to the provider. That was ticking up gradually before the pandemic, but perhaps unsurprisingly, given the impact of the pandemic, that has really been turbocharged over the last couple of years, and we've seen an increase of about a third on pre-pandemic levels of people choosing to self-fund their own hospital care. That's hip operations, knee operations, and so on. But that masks some quite interesting distinctions. And for hip operations, for example, they're up over 185% on pre-pandemic, knee operations over 150%. So we're certainly seeing many more people choose to fund their own treatment, and that shouldn't come as a huge surprise. You know, we've now got nearly 500,000 people waiting over a year for treatment in England. Prior to the pandemic, that was measured in the low hundreds. And so, you know, whilst waiting times were deteriorating pre-pandemic, they clearly got a lot worse due to the pandemic, and that's leading a lot of people to turn to look at what their options for private healthcare might be.
And is that, do you think, or do you get a sense that's pointing to some kind of new arrangement, almost informally coming about because people are voting, if you like, with their own health? They're trying to seek other alternatives where they can't find any in the National Health Service. Is that creating a new structure that wasn't there before?
So it's always been there before, and around 10% of the British population have had private medical insurance, and a number have chosen to self-fund their own treatment. What we know, of course, is that people value access to healthcare extremely highly. It's one of the most critical things that you need to consume. And if you are really struggling, which many people are, to gain access to NHS-funded healthcare at the moment, and access can still be good and the service can still be excellent, but there are those challenges. People are making logical decisions for them and their family around, well, you know, what are the alternatives for quicker treatment? And of course, that is leading to more people looking at their private options, not just, interestingly enough, Andrew, in hospital-based care, but also in private general practice, in getting a scan done. You know, it's kind of across the board, really, and I think we're likely to see that continue for a number of years.
I mean, we have two options, don't we? I suppose some NHS trusts make the decision to lean on the private health facilities with their own budgets to give access to people on the health service, and others are individuals who go into their own pockets to hurry up some of their treatment. Do either of those seem like a more viable or more likely option as we continue, or is it always going to be a balance of the two?
I think it will always be a balance of the two. I think you make an important point because, of course, patients for about 20 years have had a legal right to choose the provider for them funded by the NHS, and that includes being treated in the private sector. There are more than 400 hospitals or clinics in England alone that treat NHS patients, and that awareness of choice is pretty low, and we think the government could do a lot more to raise the awareness of that, so that when you are referred for your first outpatient appointment, you know, you're told you've got a number of options. Where do you want to go, and let's get seen more quickly. There will also, however, be a number of people that say, well, actually, I'm happy to pay for my own treatment. I want to get that done much more quickly. I've got insurance or whatever it may be, and I want to do that much more speedily. And I think we'll see more of those individuals. But I think, you know, we're seeing in England at the moment the government really recommit to this patient choice agenda. There's a new task force been set up looking at patient choice. You know, I'm really encouraging people to say, look, you know, how can you exercise choice for your NHS-funded care? And that brings material benefits. You can shave around 14 weeks off your NHS waiting time by travelling just 30 minutes to an alternative provider.
I mean, the NHS has always been a traditional saviour for those who absolutely don't have the funds to cover their own healthcare, and countries around the world envy us for that National Health Service. Do you hear any truth at all in the voices that are saying the government is trying to run down the NHS and to replace it with some other kind of system, or are we just dealing with things as we manage and as we go along?
I see no evidence that there's a sort of kamikaze political strategy to try to run down the NHS. It would be a very questionable political strategy to do that, given how highly valued the NHS is and how important healthcare is to any government, frankly, not just in the UK. I think we've encountered a number of challenges. There are clearly growing cost pressures on every health system, the NHS included, as medicine improves, as technology improves, as the demographic ages, and we know people consume around 90% of healthcare in the last 5 years of life. And it's great that people are living longer. That brings additional challenges to the health service. And clearly, we lived through in the early 2010s a fairly extended period of austerity as well, and that's brought challenges too.
Okay, David Hare, pleasure talking to you. Thanks very much indeed for joining us.